usually have a pattern of elevation, pattern of abnormalities for different enzymes, and based on which, as a hepatologist, we try to interpret what exactly is the reason, underlying pathology that can be. So for example, if I take SGOT and SGPT, or AST and ALT, the similar synonyms. So if the SGOT is more than SGPT more than 2 times, then we consider alcohol as a cause for a elevation of the enzyme. So in that situation, alcoholic liver disease is more likely to be the cause, whereas the reverse, if SGPT is more than SGOT, then we consider non-alcoholic steatohepatitis or simple fatty liver disease, or we can have autoimmune liver disease, drug-induced causes, ischemic causes as a possibility for an abnormal liver function test. You can also see the elevation of the enzymes also gives an idea about the possible etiologies for a liver dysfunction. So if I get a patient who has a SGPT and SGOT elevated around 4 to 5 times, I will consider non-alcoholic steatohepatitis, fatty liver disease, autoimmune liver disease, sometimes cirrhosis can be a possibility as a cause for the liver disease. You can also get elevated SGPT, SGOT in thyroid disorders, lipid profile abnormalities, dyslipidemia. All these disorders can give an elevation around 4 to 6 times on an average from the baseline. But whereas if you get a SGPT and SGOT more than 1000, then there are only few conditions where you can have. One of them is drug-induced liver damage, which can be acetaminophen or many other drugs which can cause a sudden liver damage. The other causes are ischemic hepatitis, where you can have a compromised liver blood flow and can have a very high levels of SGPT or SGOT more than 1000. You can also have a high levels of SGPT, SGOT in patient with bile duct obstruction. We call it as cholelithiasis. So all these disorders helps you, all these tests helps you in differentiating the different possibilities, and that is how a hepatologist interpret. So if you have an enzyme which is between 2 to 6 fold, we have a common causes which we see on day-to-day basis. But a very high levels of SGPT, SGOT speaks of rare disorders, but they are rare disorders, but they are usually seen and diagnosed in a hospital setup. Patients usually have an associated problems when we diagnose these kind of conditions.